Biomet is a global leader in orthopedics, spine, trauma, and osteobiologics. This animation presents an innovative posterior, three-dimensional spinal deformity correction technique that utilizes the power of the Polaris spinal system fixed head pedicle screw fixation, incorporating a unique helical flange locking mechanism to optimize efficiency and clinical outcome. It has always been the desire of scoliosis surgeons and systems designers to achieve three-dimensional correction since Cottrell and Dubosset introduced the concept in the late 1980s. With fixed head pedicle screws placed strategically about structural curves, we now have the power to do so. The etiology of adolescent idiopathic scoliosis is unknown, although there is a genetic predisposition. The deformity classically starts in early adolescence and progresses through the rapid phase of growth. The apical vertebrae of major structural curves rotate in the axial plane, often with an associated thoracic hypokyphosis. Fixed head pedicle screws can be preferentially clustered in groups of 5 to 7 about maximally rotated apical vertebrae and upper and lower end foundations. Following the placement of rods, contoured to match the desired sagittal profile of the spine, the rods are simultaneously rotated into the desired straight coronal plane orientation. In the double major curve example, derotator instruments are applied to the screw heads in the two clusters and fully linked with handle linkage rods and cross-connecting combs. The two curves are slowly derotated simultaneously by rotating the derotators in opposing directions over approximately 15 seconds. With desired axial plane correction achieved, cluster alignment rods are added to hold the correction in place. Holding a slight overcorrection will account for elastic rebound in the construct when instruments are removed. A vertebral horizontalization instrument can then be used to level non-level vertebrae, providing simultaneous single-level compression and distraction with no net spinal cord elongation. After horizontalization and final tightening of each sequential level, all instruments are removed. Three-dimensional scoliosis correction by this technique can result in a greater degree of coronal and axial plane correction, better maintenance of correction, improved centralization of truncal balance, and saving of lumbar motion segments by lowest instrumented vertebra derotation and horizontalization. Rib prominence correction can be significant, and greater power of correction can obviate the need for a combined anterior release procedure in curves up to 90 degrees and more. As a global leader in the spine industry, Biomet Spine provides a unique three-dimensional spinal deformity correction system. This innovative stepwise progressive technique facilitates efficient spinal deformity correction.